This skill will start with the opening. Knock and identify the patient. Introduce yourself by name and title. Describe what you will be doing and obtain permission. Close the curtain and elevate the head of the bed to the fullest upright position. If you are unsure how to work the bed controls at your testing facility, ask the evaluator to show you. Take the denture cup with dentures from the patient and place it on or next to the sink. Wash your hands. When you return to the patient, gather a clean barrier from the clean supply shelf and spread it out onto the overbed table to provide a clean area on which to place your supplies. Obtain a towel and washcloth from the clean supply shelf and place it onto the barrier. Open the top drawer of the bedside cabinet and gather a tube of toothpaste, an emesis basin, a toothette, and a denture brush. Close the drawer and get a cup of clean water. Obtain 2 pairs of clean gloves from the glove dispenser. If you do not know where the gloves are located in the testing facility, ask the evaluator to point them out. Dip the denture brush into the water and apply a small amount of toothpaste to both sides of the denture brush. Then place the prepared denture brush into the emesis basin. This basin will hold the toothbrush at the sink until you are ready to use it. Recap the toothpaste and set aside. Pick up the washcloth and a set of clean gloves and the basin with a prepared denture brush and transport them to the sink. Set the basin on the side of the sink and lay the washcloth into the bottom of the sink to prevent the dentures from breaking if they should fall. Open the denture cup and set the lid to the side. Turn the cool water faucet on. Put your gloves on. Pick up the dentures and rinse them under the running water, holding them firmly with your hand. Pick up the denture brush with your other hand and use the smallest end to clean the channel portion of the dentures that fit over the patient's gums, as well as the palate or portion that fits against the roof of the mouth. Take special care to remove all of the denture paste and food particles that may be lodged in this channel. Keep the dentures over the sink while you are cleaning them. Turn the dentures over in your hand and use the larger end of the denture brush to brush the teeth portion of the dentures, making sure you cover all surfaces, including the palate. Rinse the denture brush out under the cool running water and set it into the clean basin. Rinse the dentures under the cool running water, holding them securely so they do not drop into the sink. Fill the cup with cool water and place the clean dentures into the clean denture cup and replace the lid. Turn the faucet off. Remove the washcloth from the bottom of the sink and wring it out, placing it into the soiled linen hamper. Place a paper towel under the denture cup holding the clean dentures and place onto the bedside cabinet. Carry the basin back to your overbed table and place the denture brush back onto the barrier. The basin has only carried and stored the clean denture brush and is not contaminated at this point. Remove your soiled gloves and discard. Place the towel over the patient's chest, covering his clothing, and explain to the patient what you will be doing. Unwrap the toothette. Toothettes are soft sponges that are not as abrasive on sensitive gums as a toothbrush may be. Dip the toothette into the cup of water and apply a small amount of toothpaste onto the toothette. Recap the toothpaste and set it aside. Lay the prepared toothette into the basin. Apply your gloves. Grasp the basin in one hand and the toothette in the other and ask the patient to open his mouth. Rub the toothette on the gums in a brushing motion, covering the front, back, and sides of the gums on both the top and the bottom. Ask the patient to stick his tongue out and brush the tip of the tongue with the toothette. Discard the toothette into the trash receptacle. Pick up the cup of water and hold it to the patient's lips so he can take a sip to rinse. Hold the basin up to the chin so the patient can spit the rinse water into the basin. Wipe the patient's chin with a corner of the towel. Offer another sip of water. When the patient is done rinsing, empty the remaining water into the basin and discard the cup. Carry the basin to the sink and empty the contents into the sink. Turn the sink faucet on, rinse the basin, and turn the faucet off. Set the basin down into the sink and spray the inside with disinfectant spray. Use a paper towel to pick up the basin with one hand and a clean, dry paper towel to dry the inside of the basin and discard. Use a second paper towel to dry the outside and discard, and a third paper towel to gather the supplies and open the drawer. Pick up the toothpaste with the paper towel and set it inside the basin. Then use that paper towel to open the bedside drawer. Place the basin inside and close the drawer, then discard the paper towel. Remove the patient's towel and place in soiled linen, being careful not to allow it to touch your uniform. Remove the barrier from the table and discard into the trash receptacle. Remove your gloves. Ensure the patient has his call light and the patient's environment is neat and clean, and ask if he needs anything else. Offer to adjust the head of the bed for comfort. Open the curtain and wash your hands. Review the steps of your skill and tell the evaluator your skill is done.
Need scrubs for your new career? Visit foryouruniforms.com and enter the code CNA Video for a special discount. Need additional resources? For Your CNA has what you need. With practice tests, an online workbook, instructional videos, practice kits and supplies, and our very own skills book with step-by-step instructions, you will feel confident when you take the CNA exam. Visit foryourcna.com today. Continuing education for CNAs are called in-services. In-services are now offered online at foryourcna.com.